TechDaily.AI, your source for technical information. This podcast is sponsored by Stonefly, your trusted solution provider and advisor in enterprise storage, backup, disaster recovery, hyper-converged in VMware, Hyper-V, Proxmox cluster, AI servers, and public and private cloud. Check out stonefly.com or email your project requirements to sales@stonefly.com. Welcome to this deep dive where we unravel the crucial technical details you need to understand. Today, we're really digging into something quite serious.
Yeah, it's about these increasing ransomware attacks hitting healthcare organizations. It's a huge threat, especially, concerning patient data security.
Exactly. And we're going to look closely at two specific recent incidents. One hit a medical group back in Maryland, and the other a hospital out in California.
And the scale is, well, it's pretty sobering. Between just those two, over 1.1 million patients were affected.
Over 1 million. That's just, it's hard to grasp.
It really is. Think about a whole city's worth of people having their private health details exposed. That's the kind of magnitude we're talking about here.
So today, our plan is to break down what actually happened. Figure out what information got compromised.
And then maybe step back and see what this tells us about how ready the healthcare sector really is for this stuff.
Right. How prepared are these places we trust with our health data? What are the real risks? Okay, let's start with that Maryland medical group attack, Frederick Health, right?
That's the one. So they reported it to HHS, Health and Human Services, back on March 28th.
Okay, recently then.
Yeah. But the actual ransomware incident, that happened earlier, on January 27th this year. And the number affected was huge, 934,326 people.
Just shy of 1 million from that one incident alone. Wow.
And it wasn't just about locking up systems, which is bad enough. They specifically mentioned data exfiltration.
Meaning the attackers actually took data out.
Exactly. They got into a file share server and copied data. So they didn't just lock the door, they took stuff.
Okay, that's definitely worse. What kind of stuff? What data are we talking about?
Well, according to their report, it could be a whole range of things. Names, addresses, birth dates.
The basics.
Right, but also social security numbers, driver's license numbers, medical record numbers, health insurance details.
So really sensitive personal and financial identifiers.
And even some clinical information about patient care, though they did say it wasn't from the main electronic medical record system. Still, that's a lot of very private information.
It really is. And interestingly, did any particular ransomware group claim this one?
As of the reporting date, Friday back then, no group had publicly claimed it on the dark web, which is a bit unusual sometimes.
Yeah, sometimes they're quite loud about it, aren't they?
They often are. It puts pressure on the victim. So the silence here, well, it could mean a few things, but it's speculation, really.
What about their response? How did the medical group handle it initially?
They said they jumped on it immediately, kicked off their incident response, worked on securing systems, called in law enforcement. Pretty standard, good first steps.
And did it shut them down?
Mostly no, apparently. They kept facilities open, except for one lab that closed temporarily. The CEO actually reported making significant progress on restoring systems by early February.
Okay, so a quick response seems to have helped keep things running, at least somewhat.
Seems that way. It definitely looks like they reacted fast to mitigate the immediate damage.
All right, now let's shift over to that California hospital attack, Dammarin Hospital. This one adds another layer, particularly around the timing, right?
Yes, it does. So Dammarin reported their breach to HHS a bit later on April 2nd, and this one affected nearly 211,000 people.
Still a very large number. And do we know who is behind this one?
We do, actually. A group called RansomHouse. They claimed responsibility on their dark website.
Okay, so they were public about it.
Very. They claimed the attack happened way back in November 2023.
November 23, so quite a while before the April 24 report.
Exactly. And RansomHouse didn't just say they encrypted systems. They claimed they stole 480 gigabytes of hospital data.
Whoa, 480 gigs. That's a massive amount. Did they release any of it?
They claimed on their site they'd partially disclosed some of it.
Okay, so when did the hospital actually find out about this attack? November 23.
They stated they discovered the incident on November 5th, 2023.
Right after the attack window RansomHouse claimed. Makes sense.
But here's where the timeline gets really, really concerning. The hospital said that it wasn't until March 21st, 2025.
Wait, did you say 2025? March 2025?
That's what the report seems to indicate, yes. March 21st, 2025. That's when they confirmed that files potentially removed way back between November 4th and 5th, 2023, might have contained sensitive info.
That can't be right. That's nearly a year and a half later. That's an incredibly long time just to confirm data might have been taken.
It is a significant time lag, yes. It stands out.
What kind of information was potentially exposed in the Dammarin case? Similar stuff.
Pretty similar, yeah. Names, birth dates, social security numbers again, driver's licenses, other IDs, but also credit and debit card information this time.
Ah, direct financial data too.
Yes, plus the medical and health insurance information, so a really damaging mix of personal, medical, and financial data.
And when did they start telling the nearly 211,000 people affected?
Notification apparently began on April 2nd of this year.
So basically, right when they reported it to HHS, but months and months after the incident, and seemingly quite a while even after they confirmed data might have been exposed, if that March 2025 date is accurate.
Correct. Again, that delay is noticeable.
It really is. Let's talk about the rules here for a second. APA, right? There are specific rules about reporting this kind of thing.
That's right. Under HIPAA, if a breach affects 500 or more people, the organization has to notify HHS within 60 days of discovering the breach. Not necessarily confirming every detail, but discovering it.
60 days from discovery. Yep.
And they also generally have 60 days from discovery to notify the actual individuals affected, and sometimes the media, too.
And ransomware attacks, especially those involving taking data, they definitely count as reportable breaches, don't they?
Oh, yeah. The guidance is pretty clear. Ransomware usually results in an impermissible disclosure of protected health information, so yes, it's generally considered a reportable breach.
So that 60-day clock starts ticking from discovery, which makes that long delay in the Dammarin case from November 2023 discovery to April 2024 notification. Well, it raises some serious questions against that 60-day requirement.
It certainly does. You have to wonder what was happening during that period. Investigations take time, absolutely, but the notification deadlines are there for a reason.
It really underscores the difference between maybe having a plan on paper and executing it effectively under pressure. Which brings us to the bigger picture, right? How prepared is the healthcare sector overall?
Well, it's interesting. There was a report by Semperis looking at cyber preparedness across different industries, including healthcare.
And what did they find? Are healthcare orgs feeling ready?
On the surface, maybe. A huge majority, 98% of the healthcare people they surveyed said they have comprehensive cyber crisis response plans.
98%. That sounds fantastic. Problem solved.
Well, not so fast. Here's the catch. Despite nearly everyone having a plan, a really worrying 71% said they still had at least one major incident in the past year. An incident serious enough to actually stop critical business functions?
71%. So almost 3/4 had their plans, but still got hit hard enough to disrupt critical operations.
Exactly. And it gets worse. Almost a quarter, 24%, had multiple incidents like that.
Wow. So the plans exist, but they don't seem to be stopping these high-impact events very effectively. That's quite a gap.
It really is. The report also found that while most, about 78%, have integrated cyber response into their bigger enterprise crisis plans.
Which is good, integrating it.
Yes, but only 70% actually update their specific cyber playbooks, their run books, regularly, like monthly or quarterly.
Only 70% update regularly. In cybersecurity, things change so fast. A plan could be out of date in months.
Precisely. An outdated playbook isn't much help against new tactics. There was a quote in the report that summed it up well. Something about a dangerous gap between an organization's perceived readiness and real-world response capabilities.
That phrase nails it. Perceived readiness versus reality.
Yeah, and they pointed to some reasons why this gap exists. Things like communication and coordination problems between different teams when an attack actually happens.
Cross-team communication breakdowns. I can see that being a huge issue in a crisis.
Definitely. And also the sheer complexity of trying to manage everything using lots of different tools, especially those out-of-band tools you need when the main network is down or compromised.
Right, the backup communication and control systems. If they're clunky or teams aren't practiced with them.
It just slows everything down when time is absolutely critical, and attackers know this.
They pick their moments.
You bet. The report mentioned attackers love targeting holidays, weekends, maybe during big company changes, times when they know the defenders might be slower to react or less coordinated.
Okay, so let's try and pull this together. What are the key takeaways here for us, for the listeners?
Well, first, it's crystal clear that ransomware is a massive and, frankly, growing threat specifically targeting healthcare.
And the data involved is about as sensitive as it gets.
Absolutely. Names, social security numbers, health conditions, insurance, sometimes even credit cards. The impact on individuals if that data gets misused is just potentially devastating, financially, privacy-wise.
Yeah, it's not just an inconvenience. It can have real, long-lasting harm.
For sure. And I think this connects back to everyone listening, even if you're not in IT. It shows just how crucial effective planning and timely execution are.
It's not enough to just have a plan gathering dust on a shelf.
Right. That gap we talked about, thinking you're ready versus actually being ready when a sophisticated attack hits, that's a real danger zone for any organization handling sensitive data.
And that discrepancy is fascinating, isn't it? Almost everyone has a plan, yet so many are still experiencing major disruptions. It says a lot about the quality of those plans, how well they're tested, how good communication is, and if the tools are really up to the job.
Couldn't agree more. So just to recap quickly, we looked at two big attacks, over 1 million people affected combined. We saw the incredibly sensitive data involved.
And that really concerning notification delay in one case.
Yep. And then the broader picture from that Semperis report showing that even with plans in place, healthcare is still struggling with effective response in many cases.
Which leaves us with a pretty important thought, doesn't it? Given how clever these attacks are getting and the serious harm they cause.
What are the ongoing duties? For organizations, yes, but maybe even for us as individuals.
Right. What's our collective responsibility in trying to protect this sensitive information in a world that's just more and more connected, more and more vulnerable?
It's a tough question and definitely something worth thinking about. It's an ongoing challenge in this evolving landscape.
Indeed it is. TechDaily.AI, your source for technical information. This podcast is sponsored by Stonefly, your trusted solution provider and advisor in enterprise storage, backup, disaster recovery, hyperconvergent VMware, Hyper-V, Proxmox cluster AI servers, and public and private cloud. Check out stonefly.com or email your project requirements to sales@stonefly.com.